Local hospitals in need of more hospital beds to treat patients. KPIX 5's Wilson Walker is live at San Francisco General with that story. Wilson?
Well, Ken, you just heard the governor about 10 minutes ago talking about this forecast that they're looking at. They're looking on a scale of 8 to 12 weeks before they have a good idea of how this curve's unfolding. That gives you a good idea that this is not something we're going to see immediately in the coming days. This is something that's going to unfold over a couple months the way they see it. Now, every day the governor gets up, they have a fresh set of data and statistics. They run it through a bunch of AI simulations, and they get a better idea, they say, of what is going to happen. And the numbers keep wiggling around a little bit. Last Thursday, we were out here talking about needing an additional 20,000 hospital beds. Well, now we are going to need more, we are told.
We need an additional 50,000 beds in our system. Our new modeling suggests 50,000 is the new target number.
The governor says new projections mean even greater need for more beds. From Seton Medical Center in Daly City to the Navy ship Mercy, we have shown you how some of this is being lined up, but the largest piece will actually come from within the hospitals with a push to expand their capacity by as much as 40%.
The hospitals already came with a surge plan of anywhere from 15 to 20% of their capacity. They are doubling that surge plan now.
Unused buildings, converted floors, even parking lots. Hospitals are now drawing up plans for where to add that additional capacity. They also have to keep packed hospitals from being overrun by a highly infectious virus.
At this point, part of our surge plan is potentially moving patients that are positive for COVID-19 or rule out COVID-19 into different areas of the hospital to consolidate care and to focus our resources that we need for those patients.
The city of San Francisco is also still looking for more space. Last week, we were told Bill Graham's Civic Auditorium was looked at and found to be not so great a fit. Now it is still a possibility, and you can add a couple of places to that list. The city is looking at a number of piers on the San Francisco waterfront to see if they could house a large number of people. And one more possibility is the cruise ship terminal, now sitting quiet on the Embarcadero. All right, remember, you're talking about two different populations with both the city and the state there. One, folks who would like to get off the street during the course of this, and two, the people that are sick but don't need an ICU bed. You might need a place to put them so they don't get other people sick. So when they're looking for spaces like that, it's kind of an either or, and they don't think they have quite an answer yet. Now, how are the hospitals going to get ready for this? How are they going to operate? I think we are going to learn more about that tomorrow. SF General has a press conference scheduled to talk about how they are going to meet this request for an additional 20% of capacity. We are live here at SF General. Wilson Walker, KPIX 5.